Many children are affected by the developmental disturbances in the tooth. Today we discuss what are these disturbances and what they will lead to. They can either be the developmental disturbance in the size, in the number, in the form, in the shape, or either in the consistency of the enamel or the denting. So first let us discuss with the developmental disturbance related to the number. So they can be either, or let us discuss the developmental disturbance which are related to size are either microdontia and macrodontia. So the microdontia, it is generally a smaller size of the tooth than the regular size of the tooth or structures. So microdontia can either be either the normal microdontia, it can be relative microdontia, or then it can also be a focal or the localized type of the microdontia. So as I have already explained, microdontia is a smaller size of the teeth than the normal size of the tooth structure, which is generally found in children or in an adult. So it can either be either true or generalized microdontia, then focal microdontia, or which is a pseudo or a relative generalized microdontia. So what is a true microdontia? In true microdontia, the size of the teeth will be smaller, or generally in all the teeth will be smaller in the oral cavity than the normal size. For example, the size of the central incisor, the lateral, the canine, the molar, all will be smaller in size. This is generally encountered in the pituitary dwarfism, where the entire stature of the patient or entire stature of the child is smaller in size than the normal child, or child is called as dwarf. Then come the relative generalized microdontia. In such cases, the jaw size is generally larger than the normal. So the teeth will appear generally smaller in size. The teeth may be normal in size, or the exact dimensions of the normal size of the teeth may match, but due to relatively larger jaw, the teeth may appear smaller comparatively. So such cases are also rare. Then comes the focal or the localized microdontia, in which one or more teeth are involved, but not all the teeth of the oral cavity are involved. Such teeth are different in size and shape and smaller than the normal teeth. For example, the peg lateral. The lateral incisors, which are peg type of shape and have a smaller size, they also have a smaller root. They usually converge incisally and are generally cone shaped. They can also be found in syphilis, congenital syphilis, or in the case of pedocranial dysplasia and other syndromes. The root is fewer and shorter in size. Then comes the macrodontia. Macro means large. That is, the size of the tooth is larger than the normal size and shape of the tooth. Further, they can be classified into generalized macrodontia, in which all the teeth are larger in size than the normal, and such type of cases are found in pituitary gigantism, in which the entire stature of the man or the human being or the child is larger. The jaws will be large, the teeth will be large, the entire limbs, the height will be too high. So these are the features of gigantism. Then comes the relative macrodontia, in which the size of the jaws will be smaller than the normal size of the jaws. So the teeth will appear relatively larger. This will lead to crowding of the teeth, and it will also lead to malocclusion. Then also comes focal macrodontia, in which the tooth are larger in size than the normal. Only one or two teeth or few teeth may be involved in such cases. Generally, the third molar, the lateral incisor, is involved. Then coming to the number and eruption of the teeth. The number, sometimes it can be supernumerary teeth are there, in which the additional teeth are present in the oral cavity than the normal teeth which are already present. Such teeth are known as the supernumerary teeth. The most common or frequently occurring supernumerary teeth is the mesodense, which is generally cone shaped and it has a shorter root. It is a smaller tooth which is found between the two incisors. The supernumerary teeth can be found in both primary and permanent dentition in maxilla as well as mandible. Sometimes the supernumerary teeth can also be associated with impaction, and there is a syndrome which is a basal cell nevus syndrome or the cleidocranial dysostosis syndrome, in which a number of supernumerary teeth are formed impacted in the jaws. So there are certain type of supernumerary teeth like the mesodents, as I have already told. It is found between the two central incisors. Then the paramolar, which is found in the periphery of the molar. Then there is a distomolar, which is generally found distal to the molar of the oral cavity. So supernumerary teeth are the additional teeth in the oral cavity than the normal teeth. Sometimes maxillary or the mandibular, premolar and the lateral incisor are also formed exceptional to the normal teeth. They are also known as the supernumerary teeth. So as I have already told, the mesodents is a supernumerary teeth between the maxillary central incisor. It is small and rudimentary. Then comes the decrease in the number of teeth, which can be either anodontia, which can be complete or partial or focal. Then it can also be true or pseudoanodontia. What is complete anodontia? Complete anodontia is the loss of entire teeth. It is generally found in certain syndromes like ectodermal dysplasia, in which there is the loss of teeth, and there can also be loss of hair and other additional features. So then leading to oligodontia. Oligodontia is generally number 6 or more number of teeth are present in the oral cavity, or very few teeth are present in the oral cavity. This is also present in the ectodermal dysplasia type of syndrome. Then the pseudoanodontia. Sometimes the tooth can be extracted or impacted below the jaws of the oral cavity. So such case it is known as a pseudoanodontia. False anodontia, in which there is a extraction of the tooth has taken place, and there is a extraction space is created, or the edentulous arch is created due to the extraction or the exfoliation of the teeth. Then coming to the number on the eruption of the teeth. Sometimes it can also be impaction, which will lead to a decreased number of teeth in the oral cavity. The impaction may be either due to ankylosis, that is fusion of the tooth to the underlying bone. It can also be due to uneruption of the tooth due to hindrance of the path of the eruption. Sometimes the primary teeth may not exfoliate on its normal time, and other teeth may come into the oral cavity. This will block the further permanent teeth from erupting, and it will lead to future ankylosis. Then coming to the form and the shape of the crown or the root. The anomalies in the form and the shape. The anomalies of the crown are: first is the fusion, then the gemination, the taurodontism, the talus curves, the Leong's clus, the dens invaginatus, the dens evaginatus, mulmony molar, and the Hutchinson's incisor. So let us consider individually each of these. Now what is the fusion? Fusion is called the fusion of two teeth to form a single teeth. Generally they have separated roots, but the fused crown is present. So if we count the number of teeth will be found to be lesser than the normal number of teeth at that particular age in the oral cavity. So fusion can be entirely of the crown. Sometimes roots may also be fused but will appear to be separate. So the fused teeth can also be known as a macrodont, and it is a larger in size of the teeth. Then comes taurodontism. Taurodontism is the larger size of the teeth, or the crown are larger in expanse or in comparison with the roots. They have a bifurcation which is shifted more apically and have a large pulp chamber. It is also known as a bull teeth, or it is a large teeth. They have elongated root and apically displaced furcation. Taurodontism can also be sometimes associated with certain syndromes like Down syndrome and the Klinefelter syndrome. They have little significance and no treatment is required. Then comes gemination. Gemination is generally the fusion or the fissure which is found. For example, there's a dental lamina and there's separation of single teeth into two teeth. This will lead to gemination. It is also known as a bifid crown type of teeth. Sometimes the gemination have the fused root canals. Then comes the dense invaginatus, that is invagination, or there's an invagination in the crown of the tooth. For example, the Taylor's cusp or the Lyon's premolar. In Taylor's cusp, it is generally found in the anterior teeth and it is found in the cingulum region. There will be a protuberance in the cingulum region of the tooth and it is known as the Talon's cusp. Now, what is a Lyon's cusp? The Lyon's cusp, it is generally found in premolars between the buccal and the lingual cusp as a tiny protuberance on the occlusal surface. Then comes the dense invaginatus, that is invagination in the surface of the crown. There is an invagination of the enamel into the dentine. It can be of various levels like coronal or radicular, type 1, type 2 and type 3. In type 1, it is generally restricted up to the enamel. In type 2, comes up to the cemento-enamel junction, and type 3 may involve the pulp or displace the pulp. Then comes the peglateral, which I have already described. Then is Hutchinson's incisor. The Hutchinson incisor is generally found in congenital syphilis, in which there is a crescent-shaped deformity which is found inside the incisor surface of the incisors, and the incisors will be deformed. The lateral incisors will be screwdriver shaped. So this is known as the Hutchinson's incisor. They can be restored artificially by composite resins or the veneers. Then comes the mulberry molar, which is also a feature of congenital syphilis. In mulberry molar, the molar or the occlusal surface of the molar is full of tiny cusps or tiny protuberance or globules, which will give it the appearance of a mulberry fruit. Then the variation in the shape of the root can be either concrescence or dilaceration or flexion or ankylosis. Such are the features of concrescence. In concrescence, generally the roots of two teeth are fused together. So such tooth should be carefully extracted. If they need extraction, the dentist should be very careful while the extraction of such teeth. Then comes the enamel pearl. Enamel pearl is a globule of the enamel which is generally found in the bifurcation or the trifurcation of the molars or the premolars. So it can contain the enamel or the dentine. It is generally found in the gingival margin. If it contains the pulp, when it is removed, it will lead to exposure of the pulp. Then is the dilaceration. Dilaceration is nothing but it is a displacement of the root or the curvature of the root as well as the curvature of the crown. It can be due to delayed eruption of the permanent teeth. It can also be due to any trauma or physical forces. It is generally a rare deformity. Flexion is just the curvature which is found in the root, which is not found in the crown. Then comes ankylosis, is a fusion of the tooth to the underlying bone. Then comes the anomaly in the structure or the form of the enamel or dentine, which is the amelogenesis imperfecta or the dentinogenesis imperfecta. So this is a hereditary condition. It is also known as hereditary brown enamel, hereditary enamel dysplasia, or brown opalescent teeth. So the main amelogenesis imperfecta, it is present due to defective genes which are coding for the amelogenin, which is a protein which is required for the enamel formation. It can be of various types, the amelogenesis imperfecta, which is the hypomaturation, then the hypoplastic and the hypocalcification. In the hypoplastic type of amelogenesis imperfecta, there is the defect in the formation of the enamel, and the enamel will be thinner than the normal. The enamel will be pitted, or sometimes craze lines will be formed in the enamel or the labial surface of the tooth, which will lead to staining, but it will not lead to caries. The enamel will be weaker in structure. So hypoplastic type of enamel, this way it is a hypo in which The enamel may cause staining, which will not lead to caries as I've already told, but then it will be defective matrix formation of the enamel. So then comes the hypomaturation type in which there will be immature enamel which is present, and it will be normal in size and thickness, but it will not have enough strength to further bear the occlusal forces and can chip off easily. Then comes the hypomineralized, the calcification of the enamel is not proper. Similarly, it has a proper thickness, but it does not have much of strength. Then comes dentinogenesis imperfecta. It is defective dentine formation or coding of the gene of the dentine, which is sialophosphoprotein. It affects both the primary as well as the permanent teeth. Generally, in dentinogenesis imperfecta, it is type 1, type 2 and type 3. Type 1 is associated with osteogenesis imperfecta. It is generally found in both primary and permanent teeth, but is more found in children. And type 2, which is not associated with the osteogenesis imperfecta, there is no deformity or defect in the bone. In dentinogenesis imperfecta type 1, the teeth will be brownish or bluish in form, and they will be defective dentine formation or very less dentine formation, so it will lead to normal enamel thickness but a large pulp. Then in type 2 type of dentinogenesis imperfecta, similarly the dentine is deformed or very thin, and the structure of tooth will not be will be very less bulky. Then in type 3 type of dentinogenesis imperfecta, there will be frequent pulp exposures and will lead to further pain and other pathosis. The cast metal crowns and jacket crowns are indicated in the case of the dentinogenesis imperfecta. Then comes the regional odonodysplasia. This is a rare condition, etiology which is unknown. It is generally found in maxillary teeth, which is more frequently involved than the mandibular teeth, and it is generally either localized or generalized. Then comes the shell teeth. The shell teeth are the teeth in which the enamel will be normal thickness and the dentine will be extremely thin, leading to the enlargement of the pulp chambers, which will lead to further frequent exposures of the pulp. The dentine may be either absent also from the teeth and in the root. It is generally more frequent found in the deciduous teeth. So these were the anomalies of the primary and the permanent teeth which I have discussed, and the properties of each. Thank you.